Thanks everyone. So my name's Tony Singh. I'm here to talk to you today a bit of my journey around starting up a business and selling a business, but also wanted to talk a little bit about some of my experiences and failures and talk through some of that. So first I wanted to sort of throw out a couple of the brands that I've been responsible to build. They're at the top up there. You probably wouldn't have seen them or heard of them, so I'll give you a bit of a context throughout the talk. But I put these photos of the law and a computer board there and some guys talking because I have a law degree and I'm ashamed of it almost. But I studied law because I happened to get enough TR to do a computer engineering and law degree combined. And when I pitched it to my dad, he said, "That's just so crazy. Like, what are you doing? Why are you doing sort of two distinct different degrees?" But I did it purely because I got enough marks to get in. At the time, I had no idea what I wanted to do. But engineering really interested me, and I absolutely love the law from a what it means to society perspective. But the actual practice of the law is so boring, it's not funny. So I kept right away from the law, but know enough about it to get me out of trouble. The middle bit there is an MBA. I started an MBA and I almost finished, but I've been almost finished for the last 10 years. So my experience at uni. So this is probably what a university lecture hall looks like. You've probably all seen them. You've probably been part of them. That's probably what my parents thought I was doing every day, but really I was probably more like the other photo. University for me was really about connection and just getting involved with what's happening around campus. What I realised sort of throughout my career or through my university career was that students are skilled at a few specialties, but what you know in the wider world really eludes you. You don't get enough exposure or experience to actually what's happening out there. Peter Thiel said this, wrote a great book, 0 to 1, have a read of it if you get the chance. So I moved on to working for corporates. So that was a natural transition for somebody with a law degree and an engineering degree. You work for a big corporate, you earn okay money, and you see yourself moving up the corporate ladder. But I realised very early that the goal is really, in a corporate job, is to make your boss happy or your clients happy. You're never sort of asked generally to make great stuff that really drives you every morning. It's really just to make everyone above you in the hierarchy happy. Okay, that's what I really realised early in my career. So I found also too, you waste a lot of time in corporates on busyness. Does anyone know what that guy's from? What movie? It's a movie called Office Space. It was a really funny movie about a guy who just sort of given up in his sort of corporate job. I'm not saying I was this guy, but what I did realise is that a lot of your day in a corporate job there's a lot of busyness, making people happy and going to meetings that don't mean a lot and not building great stuff. And that used to frustrate me a lot. But that is probably a takeaway for most people in big corporates, I would say. So corporates generally sell a service, but not products that scale. That seems to be the common theme in corporates, or the corporates that I work for. But I realised very early that services don't scale. There's only so much you can do with your own time and with your own labour. No matter how hard you try, you cannot scale a service. So I realised I've got to build products. I was product focused in what I did, generally in corporates, but I realised that that's where the future is, in commoditising what you need to deliver a service into a product. So I partnered with a doctor friend of mine called Dr. Billy Drew. We decided to work in the medical space, in the health tech space, and our ethos was making lives better. So anything we did from a tech perspective had to make lives better, and that was our catch cry, and that's what we wanted to achieve. So I also wanted to make sure that whatever we were making gave us a life, right? We just didn't want to build a business that gave us a lifestyle. We wanted to build a business that gave us our life back, which meant gave us more time back. So build a product that can scale, put processes in place and put people in charge of delivering that. So our first product was called APSPad. So I won't go through the details of what APSPad is, but APSPad works in Australian hospitals and in fact hospitals around the world around acute pain management. So if you're ever in a hospital context after you have a surgery, you're in acute pain. So your insides have been cut open and you've been stitched up. You're probably in the worst pain of your life if you weren't managed with drugs. Bar from having a baby, which I'll never have. It's one of the worst things that could ever happen to you. So we understood the problem to be quite severe in that the process in managing acute pain is pretty poor in the hospital context. So we built a system that allowed clinicians to manage that acute pain management problem more efficiently. Okay. So step one, we understood the problem and we did a lot of customer investigations. We asked about 280 hospitals around Australia and New Zealand around how big is this problem? Is it worth solving? Would you pay for it? And we asked those questions over and over again. So we built a prototype and we established a key relationship with John Hunter Hospital to be our key user of the system, and they became our advocate of the system. Then I decided to partner with a group because in the context of what we had and the broader scale of hospitals, we were just a minnow. We were sort of too small to have any influence, so we realised I had to ride the coattails of someone that did. So step three was partnering with a bigger group. They were a US company called APSPad, and we're very proud to be partnered with them. But I kept indicating with their CEO on a regular basis that, hey, you should really buy this from us. You should take this away from us. Not that we didn't like what we had, but we knew that we could only go so far with what we had and the resources we had to grow it. So in June 2017, I was very happy to say it was sold. Who's that? Everyone knows who that is, right? What movie is it from? Oh, there you go. So that's how I felt. I think, that's not me, but it's kind of like me when we sold it. So it took a year to sort of put it, in front of the CEO and articulate the vision of why he should have it and the value it would bring to his business, but we sold it, which is a great story for us because we essentially had an idea for a product, built it up, got traction and sold it on. So we didn't take it to IPO, but we got enough of a return that was worth our while. So I want to talk about this sort of statement. Successful people get what they want because they know what they want. I think the biggest problem with people, I believe, is that they don't aim high or low. It's because they don't aim at all. They don't know what their goal is. They don't know, hey, I'm starting this initiative, where does it end? And I think you have to, whenever you start a business or start a venture, you need to understand when the end is and work backwards from there. So our plan for APSPad was to get it out in 3 years, and we did there. Get out of there in 3 years, and we certainly did that. So I want to do a quick exercise. Count the yellow dots up, right? Everyone, count it up. So how many green dots were there? 5. So, you've seen this. So the idea is you got to really focus on your goals. I think at when you've got a goal and you want to deliver it, you've just got to focus on that. Everything around you should not bother about. But the problem we've got, I think, at the moment in the world, we're drowning in information and we're thirsty for wisdom. There's just not enough, there's too much noise about what we're doing, and the clarity is often hard to find in what we're doing. So my biggest takeaway would be to focus on your goals. So stop the noise and focus on your goals. So what was next? We sold APSPad. We thought about a new product, which I'll talk about soon. So I was sitting around going, I'm not unemployed, I'm pre-revenue, as you say. But I was also consulting too to supplement my income, which wasn't too bad. But we focused on a new product called Cover Me Medical, which is what I'm going to talk about now. But before I do, I'll talk about a bit of a structure we went through. So we were very mindful of the MVP that you need to build. You might have seen this slide before in different shows, but we were very mindful of what to build. In APSPad, we made a few mistakes where we built something that didn't resonate with the hospitals. We had to pull it back. Now, that wasted time, it wasted money, it wasted traction that we would have made. So this slide, I think, really describes how you would build an MVP. Get something out that delivers a small level of excitability in the market and move forward and work out what will take you to the end. We knew our goal was to build a car. In the end, that was deliver a full-fledged acute management system. We got there, but we knew we couldn't get there on day one, so we segmented it out. We know our next product had to follow sort of these rules of delivering incrementally a workable MVP. So we knew we had to build a proper team and get our team in order. We had to really look at what our team was made of. So I do this exercise with any group I engage with, and certainly my own group. I work out who you are from a hustler, hacker, hipster or holder perspective. Now, you've heard the hustler, hacker and hipster thing. I've added the holder thing from a perspective of something I'll describe right now. But in any business, a hustler is like often the salesperson or the negotiator, shows leadership skills. The hipster is the designer, or the SME, the subject matter expert. You really need that person in your business. If you're trying to solve a problem but you don't fully understand what the problem is, you're really not going to achieve what you want. The next is the hacker. It's probably an offensive term calling them a hacker, but an engineer or a developer is the person that puts what you need or want into reality. The next is the holder. Now, the holder is really important. They're the person that holds the fort, manages processes, keeps the bills paid, and gets things like HR in place. So I'm really bad at that stuff, but you often need somebody just to bring all those disparate groups together, and it's very key in your startup to have that in place. People try and be all four of these things, and it can often fail. So you've really got to understand how those skills are, or how those where those people fit in your organisation. The key thing here is that all of this is not an academic exercise, it's a commercial enterprise. You have to explain to everyone in your group that this is real stuff. You know, you're there to turn a profit, you're there to make money off what you're doing. You can't just play around the edges. You need to set really firm timelines to deliver what you're after. So I summarise sort of three things to get a startup successful, and they're around, really understanding your processes in your business. Get your processes right for delivery. Understand what your product is and how your market will resonate with it. If you don't understand that, you're really struggling to make your product relevant in the marketplace. And of course, your people. You need to understand what your people can do to deliver it. So we moved on from all of that to develop a product called Cover Me Medical. With Cover Me Medical, our goal is to connect medical clinicians in Australia in a very intimate way. At the moment, any connections around opportunity and finding cover is done via locum agencies, so they're third-party entities that connect medical professionals together for opportunity. Our product does it all digitally. So it allows clinicians to connect for opportunity. So on any given day, a clinician in a theatre might have to reach out to an anaesthetics group to have a doctor attend on that theatre list, same as having a scrub nurse or a surgical assistant. All of those processes are very difficult to manage. So our system connects and manages all those people for that particular event. So we've developed and released the product, and we have traction at the moment. We have paying customers. The market is resonating with it, with the product. We know the features we need to build because we're asking our customers constantly about what they would like, what they need, and we rank them and we evaluate all those sort of feature sets daily almost. So our goal is to reach out to 625,000 medical professionals. It's very important in your startup or your business to understand the market size and the market cap. If you don't, I have entrepreneurs approach me all the time and I ask, well, what's your market size? And they don't know. And I almost have to stop them right there. If you don't know what your market is or who they are, you're really going to struggle understanding what they want, right? So our revenue models for Cover Me Medical, which is something you've all got to be very clear on, is a clinician-based subscription fee. So doctors or allied health professionals pay a monthly fee to be on the network. The practice group or the hospital pays a fee to get some additional features to manage their clinicians. And there's an exciting advertising model through pharmaceutical groups that are interested in the data we collect. And there's there is value in the data that we have with doctors connected and interacting every day. The government's very interested in that, by the way. So we're being featured on those platforms about our product, which is exciting because people are talking about it, people are interested in it, people are purchasing it. So, I'm really excited by what we've done there. So I guess to summarise, I'm writing a book. It's called The Future of Work. And it's essentially around the concept that Cover Me Medical covers. And that is the future of work, I believe, is a contingent workforce. People are going to have skills and are going to work in disparate organisations in that sometimes you might work for employer X, sometimes you might work for an employer Y, but essentially you'll be a consultant, I believe, in the next few years. Everyone will move away from the model of employer-employee, but you'll be consulting to various groups. And so Cover Me Medical works in that way, in that you're connected to your professional body for work or your fellow professionals, and you can reach out for work opportunities in a really on-demand way. So my book covers that, and if you take that email down and send me an email, I'll give you a free copy. So if you're interested. No one's writing? Okay, that's right. Come and see me after. But that's it. That's me. Thank you so much. Any questions?
What's the exit per company?
Still the 3 year, 3 year time frame. 3 years and less. 3 years is the max. But we've got a number that we want to get to, and if we do that, I think it's time to have the right conversations with interested parties. So, yep.
So how did you come up with the 625k? So when you said you know your market.
Yep.
So where did you get that figure from?
So everyone in Cover Me Medical, or a potential customer of Cover Me Medical, is a registered clinician, and their details are sitting on a database called APRA, which is the Australian Registration for Medical Professionals. So we know who they are, we know where they are, what they practice. So that data is publicly available, but our job is to connect all of them. So we know what our market size is, and I think I like businesses where I know what you're up against, you know who you're targeting, because I think you've heard this before, if your market is the world, you've got no market. Yeah.
So how did you meet Billy, and how did that conversation start about, hey, let's do something different and new?
It was that's a good question. So our kids were in the same daycare centre together, and so one day we were at an event, like I was this morning with my kids' school, that we just got talking about what we do, and then we just kicked off from there. We became sort of best mates ever since. Just talking about the opportunities that exist, especially in health tech and healthcare. But that's how that kicked off.
And so if you're not a holder, what kind of personalities or aspects has he got, and what have you got?
I would say he's a hipster. He knows the problem domain. He's great at design. All those screens you saw and the flow is his input. I'd put myself in the hustler category, and we've got developers and a holder. I've got a very capable woman in place, and I'm going to be a little bit offensive here, but I think women make good holders. They bring an emotional maturity to the table that men don't have, right? I'll say it. We just don't. We don't handle the situation as well as women do, and so I've got a really good person in place that does all that for us, pulls us all together, keeps us less crazy.
Tony, how do you get to cut through to the specialists?
So
to reach them and put the product in front of them.
So specialists, the conversations I've had and the ones I know, they're very connected to the value of the opportunity, right? So translate that, they're interested in the dollar value of their service. So you say to them, I'll give you an opportunity that you might not have been able to access before through a digital platform, and it's a lot seamless to connect to it using our network. So you kind of resonate your message around what, so you put your message in front of what resonates with them and what they're after.
One of those regulatory things it'd be interesting to hear about is privacy. So, and you said that the government's interested in the data. What kind of data set does that look like?
So, for instance, our system reaches out in the network for an opportunity. So you might say, I need a gynaecologist in Dubbo, and they swipe and it goes out for cover. If nothing comes back to accept that request, that's telling us that there's no one available with those skills in that region. Mm-hmm. So straight away that tells the government, hey, what are we doing to address the shortage of supply of labour in that region? So they're the types of data sets that we pull up.
So not patient data?
Oh no, we don't touch patient data at all. There's a conversation platform that doctors can have with each other that we're integrating with, so you can talk for clinical support with another or fellow professional clinician, but never patient data. We're very careful about storing any of that. We don't.
So what sort of IT platform are you running it on?
So it's a cloud platform, so it's an Azure Microsoft platform. It's all hosted here, like in the Australian sort of context, and we have to do that from a...
So it doesn't go out, the signal doesn't go outside the country?
No, it stays here. We had to do that for legislative requirements dealing with medical data, especially for APSPad, so it's all here.
Are you interested in looking at international markets?
So that partnership with APSPad, with the American partner who bought APSPad, wants to take Cover Me Medical to the US, because the problem is acute there too, in terms of access to clinicians, so we certainly will. We have a number that we need to prove here before they're interested there, but we're getting there.
So APSPad must use patient data?
It does. So it's not a cloud, it is cloud-based in some of the data, but we also have an enterprise version which stores all that data in a hospital.
So it's integrated into one of the systems,
Yes.
one of the 5,000.
That's right. Yeah, we deal with all sorts of patient management systems using that platform. Yep. Any other questions?
So with APSPad, that's what it's called, isn't it?
Yeah.
What are your key takeouts from that experience that have informed Covering Medical? Like, what mistake have you tried to avoid this time?
Yeah. Okay, so it would be that dealing with the big public health sector. I took the problem to clinicians, 300 odd. We asked the question, is acute pain management a problem? They all said yes, absolutely. If that thing was there, we'd buy it tomorrow. So all the clinicians wanted it, but when you took it to the hospital infrastructure and the hospital bureaucracy, we realised, wow, there's so many barriers there. So what we've done with Covering Medical is go straight to the person who's got the pain, and that's the clinician who can't get a work opportunity or a practice group who needs to find cover. Their problem is acute. I'm sorry to use the word acute pain, but acute. So you put the solution in front of them and you're more likely to get traction because they can accept that there's a problem and pay for the solution without having to go through a bureaucratic yes or no process. So avoid big corporates and big bureaucracies because it just is difficult to get through. That would be my takeaway.
And in terms of the local ecosystem, like you're one of a number of sort of health tech startups that we're starting to see in Newcastle. Do you think it's a good place to start and scale, or at least to that point where you're selling, or is there a special mix here, or are we not that dissimilar to other places where this might happen?
So I worked in London for a few years, and what I noticed in big cities is that you often get bunkered down in the job you have and the task you're doing because you're worried about taking a risk because the cost you incur in living in a big city is higher than what you are in a regional area, right? And also just travelling to different opportunities in a day is difficult in a place like Sydney. You're often stuck where you are because to get to the other side of town is very difficult in the same day. Whereas in Newcastle, it's really easy to get around. Accessing people is more easier. So I think opportunities can flow a bit more freer in a smaller town like Newcastle. And access to technology is easy. You can promote your product everywhere. I mean, our American partner's in Florida and we converse with them regularly. We flew out there to meet them, for all sorts of things we're doing, and it's easy to do your work from here.
And does the fact that there's a big teaching hospital, a couple of privates, a strong clinician base help? Like, could you do this in Dubbo?
Absolutely, yep. So Newcastle is really good for health tech for that reason. There is a committed hospital there in John Hunter. They want to see change. They want to see improvements in what they do. So they're willing to listen. But then once again, when you hit the bureaucracy, you're hitting into sort of a bit of quicksand there. But generally, the idea is that Newcastle is receptive for things around health tech for sure. There's some very clever people. Is that going to be a soundbite?
At 376.
Okay. At 376.
Very, very funny.
Yeah, thanks.